Hello, my name is Eileen Egan. I'm going to be your facilitator today for this interactive session on combination therapy in the treatment of type 2 diabetes. Motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change by eliciting and exploring the person's own reasons for change. The spirit of motivational interviewing is built upon partnership, acceptance, compassion, and evocation. The interview style should incorporate open-ended questions, affirming statements, reflecting statements, and summarizing statements. You are all familiar with the stages of change. Motivational interviewing is another tool that can be utilized to assist your patients in moving seamlessly through these stages without being antagonistic or accusatory. During motivational interviewing, the provider needs to express empathy. This does not mean that you as the provider need to agree with your patient's opinion. However, you do need to let them know that they are heard and you understand their point of view. The provider needs to support self-efficacy or self-confidence in the patient's ability to actually make the change. The provider also needs to develop discrepancy of ambivalent feelings when a patient is unsure of change. During this technique, the provider should minimize sustained talk and promote change talk. Finally, the provider needs to roll with resistance and not be argumentative if a patient is unwilling to change. Joni, great to see you. Thanks for coming in today.
Oh, thanks.
I understand you're here for follow-up for your type 2 diabetes. As we discussed at your last appointment, your A1C remains just a little bit above goal. What would you like to talk about today to help you get to where you need to be?
Well, how high was it?
It was 8%.
Really? Wow. Well, I don't know. I've really been trying to follow all my meds and you know, stick to the diet and stuff. I mean, I'm not an angel, you know, I do blow it sometimes, but I don't know.
So what I hear you saying is that you're having a hard time and that you're struggling a little bit with your diet. Can you tell me a little bit more about that?
Well, I do have a sweet tooth, if I'm to be totally honest. But I mean, I try to stay with non-sugar snacks, and sometimes I like to have a beer, you know, but.
So you have occasional indiscretion with your diet, but you do try and stick to the non-sugary items as well.
Yeah, I do. I really do. I mean, that's what I try to do. And I guess it's just when I feel pressured or if I'm having like a lot of stress in my life, you know, then that's usually when I go to sweet things.
You feel like stress makes you want to eat more things that you know might not be so good for your diabetes.
Well, yeah, because it makes me feel good, you know, I mean, at least initially.
So sometimes eating these unhealthy things make you feel good.
They do make me feel good. But I guess, I mean, there's other stuff I could do to, I don't know, go for a walk or something, to take a bath or something, I don't know.
So on one hand, you feel that eating sweet things make you feel good. And on the other hand, you know that doing something healthy like taking a walk or a nice bath will relieve your stress and help you feel better. Yeah. Doesn't taste as good.
But still, yeah. I mean, especially a walk, then my whole body feels good.
So you think that maybe taking a walk could help with your weight reduction and potentially improve your diabetes?
Yeah, sure, of course.
Joni, can you tell me a few things that you might be able to think of that could help you move towards eating a little healthier?
Not really. I mean, that's a tough question. I guess I should put myself into situations where, like go to restaurants that have a lot of stuff that I really shouldn't be eating, like pizza or like Italian restaurants where there's lots of carbs, and I know that's what I'm going to want to eat. I mean, who's going to eat a salad in an Italian restaurant? And then they have those great pastries, so it's a little hard to. But then, it kind of affects my social life in that way too. I mean.
So it sounds like you've been giving this a lot of thought about making healthy food choices.
Yeah, well, I want to lose weight, and of course, I want to feel better and feel healthier and be healthier.
So you really feel like losing weight will help you to become healthier?
I guess that's one of the things that would, yeah.
What would you see differently about your life in 6 months if you were able to lose some weight?
I'd feel freer. I'd feel freer. I mean, free, more free with my movement, and I wouldn't feel all gloppy and, just like be easier to get out of bed in the morning. I would feel
So
more
you think
clearly thinking, stuff like that.
If you lost some weight, you'd be more physically active and be able to be more mobile.
Yeah, exactly.
How do you think you can get there?
Well, there are some pre-exercise classes through the Parks and Recreation Department, and I think that's probably something that I can do. It's just motivating myself to get there. That's the big problem. How do I motivate myself to get there? And I was watching something actually on TV today, and I guess he was some kind of trainer or something, and he was saying one thing that is a really good idea is to put your gym bag or whatever, by the door the night before, so that when you wake up in the morning, you're not going to give yourself the excuse of, oh, it's too much of a hassle and it'll take me a long time and I'll be late for my appointments and blah, blah, blah.
So it sounds like you've really thought about some ideas to help you get to where you want to be already.
Yeah, well, my family's been bugging me that, I need to take better care of myself, and
so this is impacting
and
your
now
family.
You're bugging me about it, so.
Joni, on a scale of 1 to 10, with 10 being the most important, how important do you feel this is for you to make a change with your weight right now?
Well, I think it's probably key that it's very, very hard. It's really, really hard to routinize, to make it a part of my daily life. It just feels like such a clodge over my head, it's big.
So I hear you saying this is
day
I hear you saying this is very frustrating, trying to think about promoting healthy weight every day. And on the other hand, you've already started to consider some measures to help you get there, like packing the gym bag and putting it by the door and going to the classes at the Y.
Yeah.
So I see you're really thinking about it, and
Yeah.
you're taking some great steps in the right direction.
Thanks. Yeah, now all I have to do is do it. That's the big deal.
Okay, so what plan do you think we can start with today to get you towards that goal?
I don't know. Maybe I can set up some kind of calendar or something where, like, I mark the days that I've actually achieved that goal. And maybe I should track my weight on that calendar. Do you think that's a good idea?
I think you're thinking of some great thoughts that are going to help you. Do you mind if I tell you a few things that I know have worked for other people in your situation?
I could really use some guidance, I think.
Okay, terrific. So one of the things that's worked for other patients that we work with who have diabetes and who are struggling with their weight are developing a buddy system. So here at our practice, we have an exercise program that partners you with a buddy. Would you be interested in something like that?
Sure, yeah. Yeah.
Okay, Joni, that's great. I think we're making some real progress here. If I can just sum it up, I understand that you're struggling with your weight, but you feel ready to make some changes and you're interested in the program here. So if it's all right with you, we'll make some steps to get you set up with that, and perhaps we could meet again in 2 weeks to discuss your progress a little bit further.
Wow, 2 weeks? Okay. All right. Okay, sure. I'll do it. Okay.